Let us wait for the it doesn't appear my okay, thank you very much. Is my voice clear?
Yes, Dr. James, could you please raise more? Could you please raise more? It's okay.
Okay.
Heard, yes.
Okay. So I'm clear now. So I have here the screen slide shared already. So thank you very much. As we know, Dr. Amna discusses the classification of multiple sclerosis. Now, if you will be working as a neuro nurse, if you'll be working in the hospital or in practice, and then you are going to encounter with a patient suffering from multiple sclerosis, so neurologists, neuro nurses, the team involved with this one, it is very essential. Now you will be able to know what are the symptoms, because you will hardly find it very hard and challenging to identify the relapse, the remission is okay.
Solar.
Hello. Okay. So we have the symptoms of multiple sclerosis. Now, first, we are going to find out the central nervous system. Patient with multiple sclerosis, now the central nervous system is being affected, involving the brain also at the same time. Now, there are many symptoms that will be identified to a patient suffering from MS. So the client or the patient will complain of fatigue. So there will be cognitive impairment. So it will be hard for them to understand what's happening. And then at the same time, they are going to manifest depression. So because of the central nervous system being affected, we have what we call as unstable mood also. So that is in the central nervous system's symptoms being affected. Now in visual, usually the patient, they are going to manifest nystagmus. This nystagmus is, this is a rapid eye movement. And then we have the optic neuritis, inflammations of the optic nerve. So it is very important also as nurses, we must define here the cranial nerve number 2 is being affected with this one. So we have diplopia. So now we have diplopia. This is double-eyed vision. They are going to complain. There is one object.
Excuse me, Dr. James, sorry for disturbing you, but in the chat they are requesting if you can put it in the show mode so it will be clear for the audience. If you don't mind, sorry for disturbing you.
Full screen?
Yeah, for screen, because it is minute, little minute. You put it in the
Is this one?
show.
Where it is here? See all slide.
From the option here, I think the 3 dots.
The three dots.
I think so. Did it? What is it?
Plus
The screen.
Where's the full screen here?
check the screen option, Dr. James,
The
please.
screen option.
Screen option.
Maybe,
Yeah,
yeah.
up, maybe here, down. Your arrow.
This
Yeah.
one.
After you click these three dots,
Three
from
dots.
the list, I think check the screen option. From this list, check the screen
one?
option. Screen option, I think so. I don't know.
And then
Black, white, no. Show, no. It's
Two.
not. Last viewed.
So how about this one?
Presenter view, the presenter view, you have to hide it so the screen will be.
Okay, how about if you are going to use your, I will just stop my screen and then you'll be
No,
the one
no problem,
to,
Dr. James, because we're recording now. You can go, and after that we can make anything related to this slide, send for group, okay? No problem. You can continue.
okay. Okay, so I'm going to proceed with this. So after knowing all the symptoms regarding visual at the same time, so if you are going to observe symptoms when it comes to speech, the patient will manifest what we call as dysarthria. So meaning there's difficulty in speech, in language. And then we have also the throat. So the patient will manifest dysphagia, difficulty of, will be complaining of it's hard to ingest something if things go good. And then we have the musculoskeletal. So I think we need to, where's the full screen here? Because, okay. So I will just proceed, this one. So in musculoskeletal, now we have the what we call as weakness. Patient will complain. It seems like weakness happens. Then there is spasm. And then there is what we call as ataxia. This is what we call as movement and coordinations. And then in the sensation, so the patient will feel pain. And then we have the hyperesthesias, and then we have the paresthesias, the burning or prickling sensations. Now, these things, if you are going to do the examinations, now you will be able to find out and identify that this patient is suffering from this one. And then he's going to complain, numbness or weakness in one or more of his limbs. And then when it comes to bowel, there is what we call incontinence. So we have diarrhea or constipation. So it's not regular. And then at the same time, we have the urinary system, the incontinence, and then we have the frequency or any retentions. Now this patient is suffering. So as we identify when it comes to symptoms of multiple sclerosis, now it manifests almost, there are many symptoms that we can find in other diseases at the same time. So next, we are going to proceed with the complications of multiple sclerosis. So we have the urinary tract infection. So this is one of the complications. And then we have the visual impairment. Since the cranial nerve number 2 is being affected, they will be suffering from any optic neuritis. So impairment of the visions will be happening. And then we have the impaired mobility because of the cranial nerve number 8 is being affected with this one. Now we have the problems with bowel or sexual functions. So as I had mentioned with the symptoms, the patient will be suffering from depression. Now we have the osteopenia or osteoporosis, and then we have epilepsy, and then we have respiratory complications. So these are the complications multiple sclerosis patient will be suffering. Now, next is we have the prognostic factors. So we have this one, better disease prognosis is associated with younger age at onset. So in female gender, we have the monosymptomatic presentations, particularly optic neuritis or sensory symptoms. We have complete recovery from relapse, a long interval between presentations. and second event, relapsing occurs, we have a low number of relapses. While on the other hand, there is what we call as poor long-term prognosis associated with the male sex, older age at disease onset. Now it will be 40 years and above. We have the motor, cerebellar, or sphincter symptoms at initial presentations. We have also the polysymptomatic presentations, frequent attacks in the first 5 years, short interval between the first 2 attacks, and then there will be short time to reach an expanded disability status scale score of 4. And then there will be a progressive course. So that is all about the clinical symptoms. And then we have the prognostic factors.